We're socializing medicine. But not the way this guy wants to. I'm Sean Vade, the CEO of Communicare Plus. We're a platform that enhances chronic disease management by leveraging social networks. And we're asking for $5,000 to fund user experience trials this summer to continue enhancing our already existent product. Before I get to the rest of the presentation, I have to thank and acknowledge the rest of the folks who have helped me bring us this product here today. First, my core operations team is comprised of folks with clinical backgrounds, engineering backgrounds, data science, and also public health backgrounds. My business advisory team is comprised of 3 of my fellow MBA classmates from WashU. One of those folks is actually a board fellow with the American Diabetes Association, and that's been very helpful. And then my industry advisory team is about as robust as one as you'll find here in the city of St. Louis. We have the VP of Home Care from BJC, a business development writer from Centene, a PhD in user experience, a private equity investor, and a professor of nursing at the Goldfarb School of Nursing on this team. These 3 groups, when brought together, have the diversity of experience and expertise to build a sustainable, long-term engaging product. Furthermore, we have the motivation to bring it to market fast. So we wanted to identify a real problem to solve in the healthcare industry. And we decided, let's think as big as we can. And what we found is that 75 cents of every dollar in healthcare is spent on chronic diseases. On top of all that, what we determined was that perhaps if we were to leverage the social networks of a patient, their outcomes would in fact improve. And so we wanted to test that hypothesis by building a product that addressed the underlying issue of a lack of social circle engagement. And what we designed was a product that addresses that head on. We landed on type 2 diabetes as our initial testing ground. Just for background, there are nearly 750,000 new diabetic cases diagnosed every year for folks between 45 and 64. This basically accounts for almost $240 billion in direct medical costs. So the average diabetic patient will spend nearly 2.5 times as much in direct medical costs in a given year versus their non-diabetic counterparts. We aren't the first people in the industry to try to figure this thing out, right? But our distinct competitive advantage comes from the fact that we can effectively measure and manage social circle engagement and relay that information to the health system to intervene with patients who need additional support and resources. Further, we're trying to compete on 2 distinct variables. First, on price, and second, on complexity, because we believe that the combination of those 2 in the right arena can lead to longer-term, more sustainable engagement. Where our competitors fail today is that after 6 months, patients drop off and stop using them. And we think these 2 variables are high contributing factors to that phenomenon. Where we want to play is in the low complexity, low price arena to drive longer term, more sustainable engagement with both patients and their non-clinical caregivers. The research suggests that our lens is actually effective. Just here in St. Louis, a study indicated that patient self-efficacy, disease knowledge, and self-care all increase when family members are more engaged. Stacy from BJC indicates that harnessing the potential of the lay caregiver and leveraging technology are key to improving healthcare in our country. At Communicare Plus, this is what we're doing. So we've built a platform, a mobile application to begin, that essentially connects the lay caregiver to patients through a proactive, engaging mobile application built on a foundation of simplicity, behavior-based research, and clinical insight. And we built the product with 3 distinct pain points in mind. The first is that users are overwhelmingly upset with the fact that all their icons and text are far too small on their apps. All of our competitors received this complaint when we conducted patient surveys. So we've enhanced the font size, we've enhanced the icon size, so Communicare Plus is bigger, easier, and just simpler to use. The next pain point was the fact that most diabetic patients, if they input their blood sugar, they fall within a pretty reasonable range. They don't want to input a 3-digit number every single day, 7 days a week. Instead, they just want people to know they're doing fine. So we've incorporated what we call the single tap activity update so that they're no longer burdened by just documenting what they already do every single day. And finally, with many medication management apps, we found that many of the details that patients have to sift through winds up being below the line, so to speak, on their iPhone or their Android. So there's a lot of scrolling involved. At Communicare Plus, those details are important to us, and those details wind up mattering when the patient's in the hospital. We don't want scrolling, we don't want to miss details, so there's no more scrolling. We've included 2 kind of cool features as well. So the chart on the left side for you all is essentially a daily, weekly, and monthly tracker for positive health behaviors that a patient takes that the non-clinical caregiver can observe and essentially use to hold accountable that their loved ones and family and friends afflicted with their respective chronic disease. We've also incorporated a chat function, which we're going to continue to test, but essentially from our side, we can capture sentiment analysis to essentially determine the level of engagement that a patient's family may have with that patient. In the future, I'm a realist. I know that we have to create something. I apologize. What we're building right now is a 10-point scale for health systems to essentially identify which patients are most at risk for low social circle engagement. For patients who have low social circle scores, we can essentially come in with data-driven intervention methods that are proven to be effective by leveraging the social network. And we continue to research better ways to continue enhancing that feature, but for now, what we're able to do is identify on a 1 to 10 scale which patients need the most help. This is also effective on the other side of the scale. When a patient has a highly engaged social circle, the hospital doesn't need to deploy more resources toward that patient. In fact, that's wasteful, and we're trying to reduce that in our system. In the future, I know that we can't compete on building a better app. There are Googles and Apples that are going to steal all the best developers from us. But what we can do is be the best synthesizer of information from proliferating wearables that continue to enter the market, from other diabetes and other chronic disease management apps that continue to grow, and also from the EMRs that continue to be implemented across the country. We can synthesize and analyze that data in a way that's able to be easily packaged to the social circle so that interventions on the social side can happen, and also to continue building upon the 1 to 10 scale that we've built out for healthcare systems to manage their own patient bases. Before we get there, though, we have some quick next steps that we really need to get through. So, this summer, we'd like to do some product upgrades. By September, I'd like to be applying for IRB approval for some true clinical trials to determine whether our product actually impacts diabetic care in the future. From there, we'll raise some money, enroll some patients, and be off and running with actual clinical trials. One more thing. If you're interested, my business advisory team is finalizing a real business plan with financials and marketing structures and operations plans. If that's something that interests you, feel free to catch me after, and I'll include you on our distribution. Otherwise, we're Communicare Plus, and we're going to socialize medicine. Thanks.